we'll talk about the factors that put the child at risk for stuttering. Then we'll give you some examples of children who are at risk for stuttering. And third, we'll talk about the components of an evaluation for children who stutter. Most experts agree that some children are born with a predisposition to develop stuttering. Whether or not they will depends on how the child's physical makeup interacts with his environment as he develops.
Children with relatives who continue to stutter into adulthood are less likely to recover without therapy.
About as many girls as boys begin to stutter, but girls are more likely to recover without therapy.
Children with good speech and language skills are more likely to recover without therapy.
Children who are more sensitive are more likely to react to their stuttering and to events around them. Therapy will focus on reducing their sensitivity.
The frequency, variability, and types of stuttering and the child's reaction to it help us plan therapy.
The way you feel and what you do in response to your child's stuttering can affect the outcome of treatment. The best way to help your child is to learn about stuttering and accept your child and his speech.
You can help your child by learning about how your family communicates and what effect it has on your child's stuttering.
Are your expectations for your child in line with his abilities?
Expect that important life events, like a move or the birth of a baby, will be stressful for some children.
Many children have trouble keeping up with a busy and rushed family schedule. Examine the effects of your lifestyle on your children.
Remember, some of these risk factors are found in all children. How they affect a particular child depends on whether he has a predisposition to stutter. In this case, a combination of these factors may trigger stuttering. Here are 3 children for whom different risk factors have been identified. Joe is a 3-year-old boy with 3 older sisters. He has a big vocabulary, enjoys talking, but is difficult to understand because he can't say certain sounds accurately. He and his parents and sisters are all fast talkers. His father stutters. When Joe stutters, he holds on to the first sounds of words, and the longer he holds on to a sound, the louder he gets.
Annie is a 2.5-year-old girl and a first child. Her baby brother was just born, her mom has returned to work, and now Annie must go to a new caregiver. She's a sensitive child and reacts strongly to new situations. Her stuttering is highly variable. Some days she has easy repetitions, and some days she struggles to get words out.
Peter, a little boy, is nearly 5 years old. His mom runs a daycare in their home, and the days are very hectic. When Peter gets stuck on words, sometimes his father tries to say the words for him. When Peter stutters, he takes deep breaths and often jerks his head back.
One of the most important benefits of an evaluation is that when risk factors such as those you just saw are identified, the clinician can plan a more focused and effective treatment program for your child. The evaluation consists of a case history, a family interview, an examination of your child's stuttering and other speech, language, and hearing skills, and a conference with your family to discuss the results. You will be given a written report with specific recommendations for you and your child. You should expect the clinician to follow up with you until treatment begins. The cost for an evaluation may range from free in a public school to a couple of $100s in a clinic or hospital. Many insurance companies will cover the cost of an evaluation. Be sure to check your policy.
The next section of this video will describe therapy for children who stutter. First, we'll talk about changes you can make at home to help your child. Next, we'll describe how you can work with a clinician to change important aspects of the child's environment. Then we'll give you examples of how the clinician can work with you and your child so the child learns to talk more easily and more fluently. Finally, we'll show you samples of clinicians working with children to help them stutter more easily and thus speak more normally.
Treatment of stuttering in young children takes many forms and will vary from child to child over time. You'll begin by focusing on changes that you and your family can make. The clinician will help you make these changes and check on how they are affecting your child's speech.
The one-on-one time has worked well. We've set aside one-on-one time with Catherine for maybe 10 minutes a day, and both Kim and I try to do it every day, where we'll read a book or play a word game with her. It's given us the opportunity too to more than just work with her speech, just to spend some time with her individually, because that can kind of get used up during the course of a day if we don't consciously make the time to do that. So that's worked out well.
We made a real effort to slow our pace down, to not get involved in as many activities as I could sign up for, and there's so much out there, you know, a lot of fun activities for kids, but I've learned how valuable it is for us just to be together, for me to sit and read with him using my easy speech and modeling, which I didn't talk about so much before, but that whole idea of modeling slow speech has made a big difference also for Logan. So we have slowed the pace, tried to slow the pace in every way.
So it's really just unlimited patience, and I try to not finish sentences for her. I try not to hurry her or to rush her, and I try to calm. Maybe sometimes if we're in a little bit of a hectic situation, I just realize it's more important to take the time to listen, and I'll happily listen until she feels she's done speaking.
And also I have made and still continue to try to keep life as slow as I can and not over-program, and make sure that he gets enough rest. And it seems to have it seems to really matter for him. I can see I've become more sensitive to what is too much for him.
Let's review what you've already learned to do to help your child. You're working on using slow speech, pausing, finding more one-on-one time, reducing the number of questions you ask, and improving listening skills.
If your child needs further help, your next step may be more frequent meetings with the clinician who will work with you to make these changes.
I think the suggestions that you gave to us initially when we first called on you for help, and the things we learned during our time together in family therapy about modeling, about speaking more slowly to Hannah, pausing and letting her have time to take turns in the conversation. I think that those were wonderful, that was wonderful advice to us that really taught us how to speak to our daughter. That is good advice for any parent, whether or not your child has a problem.
But a lot of it still carries over, especially a slower, easier speech that you were teaching, that we were working on together. I think that that's something that in fact, not just my kids, but whenever I'm dealing with any kids, now even friends' kids, I always try to speak in a slower, easier style with them.
Also at home, we've implemented a thing at the family dinner where everybody takes a turn and you pass the candlestick around, and when you get the candlestick, it's your turn to talk, and everybody listens and doesn't interrupt, and then when that person's finished, they pass it on to the next person.
Because it was hard not to ask questions. For example, Marsha, as she was saying, would be saying, "I've got the blue whatever." Usually, before that, we were always, again, trying to provoke a response. "Hannah, what color is yours?" Or "Hannah, this," or "Hannah, what's that?" But instead, we had to totally alter our communication pattern there by saying, "I've got the blue one," and I'd say, "I've got the green this," and that would be Hannah's turn to say something, whatever she felt like saying at that point, instead of us trying to stimulate the response from her.
If your child isn't showing substantial improvement, or if the evaluation has identified a lot of risk factors, your child may need to work with a clinician to learn to talk more easily. You'll also want to continue your efforts at home.
But there's no room.
There's no room for another one, is there? No. Would you make me some desserts so I can eat them? Would you make some for me? We're moving our hand like this. Let's try a blue one now. One. Let's try it like this. One. Again. 1. Good. Say it just like I do. Say it with me. Okay, good. 2. Good. Let's do like this now.
Now it's my turn.
Okay, all right. Why don't you let me say it with you? Can you say it like this? 3, and then I'll say it with you. Ready? Okay, you say it now. 3. Good. You're showing me how to do it now. Okay, let's try it again. 4. Good. You're a good teacher. You're showing me how to count with our stretchy. So instead we would say slowing down means pausing more. That's one way to slow down. It means some of the stretching that you heard me do before with him. That's one way to slow down. We were playing a little game with it, and he was mimicking me in game fashion, and I was mimicking him in game fashion, but it wasn't like, I want you to slow down so you don't stutter. At least hopefully it wasn't coming across that way. So there are activities like that that you can do at home during reading time when you and your husband are interacting with him, which we would encourage on a daily basis to have just time for Nikki, 10, 15, 20 minutes a day.
And that's no problem for us.
If your child continues to show physical struggle with stuttering, shows frustration, or avoids words or situations, then your clinician may begin to work more directly with your child in some of the following ways. She will learn to practice easy speech skills, feel the difference between hard and easy speech, between bumpy and smooth speech. She will talk openly about stuttering and learn to stutter more easily.
Let's start with this one. Horse. Does that sound smooth or does that sound bumpy? Good listening, Mackenzie. That was smooth. We've been working on easy, relaxed speech. You and Mom have been modeling that beautifully, but we're finding that she's still having a significant amount of blocks. And so one of the things that we're doing now is we're working a little bit on understanding the concepts of smooth and bumpy through maybe how objects feel. I'm having her identify some of my words when they're smooth or bumpy. And then I'm going to be continuing to reinforce her that it's okay to be smooth and it's okay to be bumpy.
The first thing they did was sort of intentionally help Logan identify the different kinds of disfluencies that he would have. And so whether it would be bumpy talk, they had their own language for what was, the bumpy talk, or Mr. Freeze, they called him, when he would block. And they had a whole language, and he would intentionally do that for his therapist, and then when it would happen naturally, and then they would practice, how to get out of it. When they would practice it intentionally, and then practice how to get out of it. So then, when it would happen naturally, he would know how to work himself out of, the different disfluencies that he might experience, and he got to the point where he really could do it.
Remember, you and your family are an important part of treatment and should continue to play an active and caring role in this process.
I needed to be trained as much as Logan did. I didn't know what easy speech was, or how to help him recover, or help him learn the strategies to for how to get himself out of some of the bumpy talk and the blocking that was happening.
You've just seen a range of possible treatment options available for you and your child. We hope you feel confident that your child can be helped. And remember, your active involvement can make a real difference.